Welcome to our first season of Rural Health Today. Over the next few months, we'll be publishing a series of episodes about maternal care in rural health. We'll be speaking with experts from the Michigan Department of Health and Human Services, the Michigan Health and Hospital Association, several national maternal health alliances, and much more. Whether you're a rural mom, a healthcare worker, or attentive to what goes on in rural healthcare, this is the series for you. Our guests will be tackling topics like maternal morbidity in rural settings, genetics, postpartum health, mental health for moms and families, and how to understand and address the barriers to proper maternal health in rural America. Without further ado, let's welcome our first guest to the season. I am thrilled to be in the studio today with a very special guest, Dawn Shanafelt, and she is the director of the Division of Maternal and Infant Health at the Michigan Department of Health and Human Services, affectionately known as MDHHS. We'll probably use that throughout the podcast today, so we don't have to pronounce that long word. So, Dawn, this is your first time in our studio. We're raising awareness of the issues facing rural America. This is a podcast that goes out throughout the country, and we're talking about some success stories. And Michigan has some success stories thanks to you and your department. And I want to highlight those in the work that you're doing, and really to give our listeners a sense of, can we duplicate some of the great things that Michigan is doing? And that's obviously, as the director, that's under your leadership, and we want to thank you for that. We'll get into some of the specifics about how we as a hospital have participated in programs such as centering and other things. But before we begin that journey, folks don't know yet, right? And they're listening from across the country. They're like, well, who's this Dawn gal? Let us know a little bit about your background and what you do at MDHHS.
Absolutely. So I'm so happy to be here today and to talk with all of you. So as far as what I do at MDHHS, I'm the director of the Division of Maternal and Infant Health, and then also Michigan's Title V Maternal Child Health Director. Each state in the nation has an MCH, or Maternal Child Health Director, and I serve in that role for Michigan. I have been with MDHHS for almost 11 years.
Congratulations.
Thank you.
That's awesome.
And then prior to that, I worked in local public health at the Saginaw County Health Department for over a decade. My career has a winding path. I'm both a nurse and a social worker. Okay. So I have worked at the bedside and in hospice, domestic violence, substance use. Yeah. So again, a winding path, but all in that entire time was focused on maternal child health. Our division, as you said, is one of the lead divisions in state government to advance maternal, infant, and family health in our state. And we are home to an array of initiatives and programs focused on healthy moms and babies. Everything from home visiting to centering pregnancy, as you mentioned, to efforts to decrease the number of sleep-related deaths for babies in our state, efforts to improve breastfeeding rates, and to assure that all families in Michigan have access to a doula. And I'll talk more about that in a moment. But definitely we're doing everything that we can to invest and build upon the great strengths of our state, and then eliminate barriers and challenges that face families when they're trying to have a family, raise a family, and flourish.
You're doing an amazing job, and the depth of your programs are fantastic, and the reach is incredible, the lives that you're changing. We shudder to think about some of the news nationally, and I won't ask you to comment in your role, but certainly concerning about some of the cuts that would impact programs like yours, that would impact communities like mine, because you do provide a significant resource to our moms and families. And to have that just go away at any level, whether it's reduced by 50%, 20%, would take a huge, huge hit in our community, because the work that you're doing is providing such needed resources to our families right here in Hillsdale. And so I want to first congratulate you for success in your department and the work that you're doing. And second, to encourage you to keep the fight, because it's worth fighting for, and the families that need us out there. So don't lose sight of that. But, for someone who, we need to humanize this a little bit, all right? So someone may not know you. What's a fun fact about Dawn that maybe, you just want to share with us, and they go, you know what, I can resonate with that. What's a fun fact about you?
I was thinking about that question as I was driving here today. And I think that maybe not necessarily a fun fact, but an interesting fact. When I was thinking about how I got to the place where I'm at in my career, I thought back to the fact that, so I currently live in rural Michigan.
Yeah.
My family is from rural Michigan, and the grandmothers on both sides of my family were both. Remember hearing those stories about, in particular, my maternal grandmother was so tiny that the family kept her in a shoebox.
Oh, my goodness.
So as a child, again, you heard the stories and thought about the challenges that some of the women and mothers in my family were faced with. I think that we hold that history and our ancestors in our heart and take that with us. And I had never really thought back to that or why maternal and child health was so important to me. Obviously, obviously, your listeners don't know this.
Right.
I've been married for almost 36 years here in a couple weeks.
Wow, congratulations. That's amazing.
And I have 2 children that are the loves of my life.
Absolutely.
And they're amazing people.
Now, the real question is, do you have grandchildren?
Oh, gosh, I wish I did, but
now,
I don't.
Let me tell you, I just got my first 2 not too long ago, and it's amazing. You're going to love it.
I know I will.
You're
I can't wait.
Yeah, it's amazing.
Time.
You're just going to say all this stuff is just child's play. This work, that, what we do until you get those grandkids. But that'll be for you to look back and say, you know what, he was right.
Oh, I know
it's
you
a fun
are.
time.
Congratulations. I can't wait for that to happen.
Thank you. It's great. Well, the work that you're doing, again, cannot be underscored by, it sounds like, your history in your family, and you hold that very close to your heart. So purpose-driven life that you have.
Absolutely.
With what you went through, what your families have gone through. If you're just tuning in, today we're talking about maternal health in Michigan. And while every state's healthcare looks a little bit different, Michigan often sees challenges and opportunities that are, in fact, unique from other states. So Dawn is here to share her perspective and insight as a leader in the effort to improve Michigan's maternal health care. We'll talk about the barriers of care, public health programs in general, and of course, what it all has to do with rural health, because after all, that's what this podcast is about. So let's start with the basics, okay? Tell us about what maternal health in Michigan looks like first, and then we're going to get into some of the struggles that we face. But what does it look like today? If you could wrap your mind around it verbally, could you tell us?
So I can tell you that Michigan has really ignited strides forward in the last several years to ensure that we are enhancing existing systems, whether that's the birthing hospitals in our state, programs that serve families, really embracing a holistic model of care that benefits maternal and infant health outcomes. And I think those investments and truly elevating family voice. I work for the state of Michigan, and I work for all of the families in the state. And in order to do that, we need to have advisement from the folks that we work for. And so all of the efforts that we'll be talking about later on in the podcast are the result of what we heard from families throughout our state. And so in that vein, I think that we are, at this point, positioned to continue seeing improvements.
Yeah.
And so as far as maternal health, in our state, we still struggle with maternal mortality. In Michigan, there are 90 maternal deaths that happen every year in our state. Maternal deaths are the deaths of someone who's pregnant up to 1 year postpartum. And the fact that we are in 2025 and still struggling with that is absolutely concerning.
Very concerning.
And particularly given that 80% of the deaths are preventable.
Yeah.
And we focus on strength. So the fact that they are preventable means that there's something we can do. Yeah. There's definitely hope shining through that we can save the lives. And the folks that are listening can't see in the studio, but there's a tree there. And I often, the image, I often talk about that when there's a loss of a mother in a family, the family tree is permanently altered.
It is.
And the same holds true for the loss of an infant.
Yeah.
Historically, Michigan has higher infant mortality rates than the other states in the nation. But again, we're making strides. We're seeing improvements in both maternal morbidity and mortality and infant mortality, most definitely. So this year, the infant mortality rate was just released a couple weeks ago, and we hit another lowest on record infant mortality rate in our state. Yeah. It's 6.1, and I've been doing this work for close to 30 years. So to actually see those numbers come down from double digits to get us closer to the U.S. rate means that
pretty remarkable.
Something's happening in our state, and that happening is that we're all working together. Yeah. And to make changes and see a better
and
trajectory.
And the results are happening.
Absolutely.
And that's what's amazing. You know, in later episodes, we're going to be talking about postpartum screenings and counseling, as well as fetal loss, counseling, because it really takes a team to come around and surround the families. If you could look in your career over the last 11 years as director and look at what you've done as a department and as a program, could you name a couple achievements that you're really proud about that, you just gave us one, obviously lowering that threshold, but what other things would you say were one or more achievements that you can really say that's what we did, proud of it?
Absolutely. So I think definitely the fact that Michigan was one of the first states that expanded postpartum Medicaid coverage. So back several years ago, families that had Medicaid insurance when they were pregnant and in the postpartum period had that insurance up to 60 days or 2 months postpartum.
Is that right? I didn't realize that.
8 weeks. And
it capped at 8 weeks?
It was capped at 8 weeks.
I did not know that.
Now the families have, pregnant and postpartum patients have insurance up to 1 year postpartum.
Great.
And that has spread across the nation.
Okay.
And all of the states, minus, I did a bit of research last night because I know it's, again, igniting like a fire across the country, that this is really important. The time after pregnancy is really important to wrap our arms around mothers and families. But Wisconsin has coverage up to 90 days. Arkansas just voted a couple days ago to expand their postpartum coverage, and it was it did not pass. But most states in the nation now see the value and investment in covering that full year. Things such as chronic health conditions, mental behavioral health challenges, those things don't go away 8 weeks after having a baby.
No.
So it's really important to do everything we can to keep mothers healthy after pregnancy, between pregnancies, so that, again, that trajectory of health can be sustained.
Was that a legislative action, or did you petition the state, or how did that work? How did you get that the coverage to occur to 1 year?
So that's a Medicaid state plan amendment, and then also you need the resources, right, to do that too. Yeah. So that requires our legislative partners and administration for that to happen.
And we had to witness the increase in better health outcomes as a result of that. So, I mean, the numbers probably are speaking for themselves, especially in states that do expand that. It's very concerning to hear that, it's 90 days. And I did not realize that our plan up until it was amended did that. So that's a huge achievement. Any other achievements that you can think of that you're just proud of?
Yeah, definitely. One thing that I'm very proud of is the Michigan Doula Initiative.
Yeah.
Doulas have been around for hundreds of years serving families. Yeah. And up until January of 2023, families were only able to have a doula if they were able to pay for one.
Right.
Now, Medicaid reimburses for doula services. So that means that families can have optimal care regardless of what type of health insurance that they have. And as a result, we've seen the number of doulas in Michigan just skyrocket. Yeah. So right now, there's close to 700 doulas serving the state. Every corner part of the state, you should be able to access a doula. Noting, though, that we have, on average, about 100,000 births a year. But the numbers are rising. And also what that does is it provides, again, I mentioned the word holistic prior. It provides holistic care. It's a whole care team. When we think about it, it takes a village, it takes a community, it takes a team to result in better health outcomes.
So let's talk about doulas. So there was a period of time when we had doulas here in our OB. Unfortunately, you did not get reimbursed for those doulas, and so it was truly an added cost. And then when your population is majority Medicaid and you're already taking a loss, it's hard to be able to sustain programs that you get no reimbursement for. So in your in this program that occurred in 23, and I did have some of your counterparts here a few months ago from MDHHS talking about Medicaid expansion in Michigan, and they had mentioned this, and I did send in some information to our OB manager, but is it hospital-based or is it community-based? So if a doula program, if someone's listening today and says, I want that, how do they get that?
So they go to michigan.gov/MIH for maternal infant health. Okay. And we have a doula initiative webpage, and you can click on the map in Michigan, and you'll get a list of doulas that are serving your county, along with information about which Medicaid health plans they have contracts with. So Michigan's doula program is community-based doulas.
Okay, so it is community-based.
Community-based doulas, but they can provide services in the clinical setting.
They can do that.
So the doulas are able to go to appointments with families, prenatal appointments. So they're able to be there at the entire time of labor and delivery, in the postpartum period. So definitely be part of the care team, whether they work independently or, are indeed a staff member of a hospital.
Yeah. Well, my wife's an OB nurse, and so she often reminds me of the value of doulas and encourages me to bring doulas back. And this sounds like it's one way for rural hospitals like Hillsdale to achieve that without necessarily hiring them. There's actually community resources. Now, what, to your knowledge, is the industry oversaturated with doulas, or is it hard to find doulas? Is the training available? Do you know anything about that?
So it's definitely, the industry isn't oversaturated.
Okay.
We, as part of the doula initiative, cover the cost of training for individuals who want to be doulas. So that's definitely helps as far as when we think of economic development and stepping stones into birth work. And the individuals who want to become doulas, they're paid for their time, so they can cover child care and all the other costs, right? If particularly if they have to step away from the job that they're currently working in order to go to a training, they can do that. And then we assist with getting into contract with Medicaid health plans because the doulas bill the Medicaid health plans themselves. Many have entered into group scenarios where they bill as a group, right, to decrease the cost of overhead so that they can be successful. But I mean, doulas have been proven to improve birth outcomes.
Oh, we know that.
So there's definitely a return on investment.
There is. It's incredible. And so if someone's listening today that says, I might want to be a doula, how do they pursue that? Is there resources available?
Absolutely, there are. So they would definitely go to the website that I mentioned a moment ago. Or if my contact information is shared in the podcast, they can call me.
Yep.
And we can let them know what trainings are available in their community or near where they live, when those are, and then they can get registered and go through the steps to become a doula. And all of the trainings that we sponsor at MDHHS are Medicaid approved.
Oh, good.
And we've done that. You'll see a theme here in partnership with the doulas in Michigan. So we have something called a doula advisory council. It's a group of doulas, close to 30, and they're from every corner of the state, varying backgrounds on doulas. Some are full spectrum, some are postpartum only, just a variety of doulas. And they help advise and drive the Michigan Doula Initiative to assure that what we are doing at the state of Michigan really reflects what's needed in the community.
So you heard it right here from the director. And she is telling you that if you are in need of doula services, those are available. Access and resources are available for you. And if you're interested in becoming a doula, sounds like there's some opportunities there as well. So we talk about the achievements, and we could spend a long time talking about that, but you've also had a lot of struggles. And if you could identify maybe a few barriers and struggles right now that you're challenged with, let our listeners know, what are those?
Definitely struggles include chronic health conditions that families are faced with. So individuals coming into pregnancy, during pregnancy with challenges, things such as asthma, diabetes, substance use disorder, whether actively using or in recovery, those pose challenges, mental health challenges, hypertension. So again, individuals coming into pregnancy with health concerns, that's challenging because pregnancy stresses the body. And when you add, it's an amazing time, but when you add that stress, that can definitely complicate health conditions that are already present. In addition, we've seen care deserts here in our state, whether that's prenatal care provider deserts or hospital deserts. When I started this position, there were 84 hospitals in Michigan that were birthing hospitals or that deliver babies on a routine basis. We are now at 74 hospitals with another one that's slated to close. So that's a challenge when folks have to, when we think about rural parts of the state, when they have to drive a distance.
Hour, 2 hours.
Right. And then you factor in the weather.
We
have
inclement
four
weather.
Seasons, right?
And they're all inclement.
Just snowing a couple days ago.
Yes, it was.
So when you add that in, that makes it even more challenging. And then when you add in the challenges of social determinants of health, when folks are trying to figure out ways to get rides places, and now they need to figure out a ride that's even further away.
So can I stop you right there? Because I want to, this issue is going to intensify even more if the cuts to Medicaid occur. And I just want to interject here because it's our time to really say we need to speak out because we're already talking about hospitals of closed or OBs. Coldwater, just 25 miles from here, closed or obstetrics. Sturgis, closed or obstetrics. So within 100 miles, there's only a few hospitals delivering obstetrical care in closing their labor and delivery and just shutting their doors. And the uniqueness of Hillsdale is we're joined by 2 other states, Indiana and Ohio. And those states also in the adjoining counties are closing their obstetrical units. And as a result of that, there's a lack of access to care. Now, when we talk about why it's so important for our community to advocate, and this could be across the country. This isn't just Michigan. So when you're listening out in Montana, this impacts you as well. And Medicaid is cut to the bone and even deeper. I mean, it's slashing the bone. These are going to become more and more common to see closures of those programs. And then you talk about care deserts. The vast span of these deserts are statewide. You will not have access. In our particular case, people are going to be driving hours to get that care. I just wanted to highlight that because right now in our country, there seems to be this approach of, we're going to wait and see what this Medicaid thing does. And, it's not going to happen. It's upon us. Just this week, Congress unveiled their budget, which passed, and by most likely partisan lines, and we can draw that. And as a result of that, there is going to be a very significant impact on programs like these. But it's not too late. This is what I tell folks. We can still get our voice heard if we contact our legislative representatives, both in the U.S. House and the U.S. Senate, because we cannot shift this cost to the state of Michigan. Could you imagine going to Governor Whitmer and saying, Governor, we need $10 million to be able to do this? It's not going to happen. It's just not going to happen. So I know you have to take somewhat of a cautious approach to this, but it's my voice saying we have to lift our voices in unison together to say these cuts would be detrimental, because what you've just explained to us in these deserts would only look 100 times worse than they are today. So I just want to interject that. I will yield the mic back to you so you can continue to talk about some of those struggles.
Yeah, absolutely. So I think that when we mentioned, we were talking about the healthcare desert, I think for the topic at hand, for maternal health, birth is precipitous. So you don't necessarily know when the baby is coming. So that's why it's very important that you have access to the resources, whether it's routine delivery or it's emergent delivery. Yeah. That's something that I think when we think about the hospitals in our state and the resources in our state, families choose communities to live in, to raise a family, and based on healthcare. Yes, based on healthcare, based on the resources that are available. Yeah. And so closure of additional hospitals, it's devastating.
Yeah, and there's research done that actually shows that healthcare is now number one. It used to be schools. Families used to relocate based on the school systems, but now it's healthcare. So healthcare, then education, that in communities where you're going to lose your hospital, that is tough. Your community suffers. People are not moving into that community. But beyond that, there's folks that are going to be trapped here, though. We're not talking about the ones that move here, the ones that are already here receiving those services. Someone told me, well, if you close your OB, you're still going to have your OR and your ER, and they're still going to come in. And listen, we're talking about hospital closure in general. That means there's no services. We just have to be mindful of that. But to your point,
definitely.
As we look at it, any other challenges you want to make known before we get into some more meat of our substance today?
The challenge that I would make known that we've been overcoming in our state since Healthy Moms, Healthy Babies was launched in 2021, but I think it's important to raise this up because we don't want it to become a challenge again. Improving maternal and infant health outcomes, family health outcomes for the long term, that requires long-term sustainable investment. This isn't something that can be fixed with 1 year of investment and it's fixed. These are complicated challenges that families and communities are faced with. And so overhauling systems, making systems better, like I mentioned for postpartum Medicaid expansion, doula access, home visiting service access, access to substance use providers, just a host of things, that requires us to be in the game for the long haul. Yeah. And so I think we need to, sometimes when things seem to be improving, we think that, that we can shift our focus to something else. And when you do that, the problems resurge.
Absolutely. So would you say, as you look at Michigan, would you say we're unique? Would you say our state is like every other state? And then I guess what would set apart state from state as it pertains to maternal health?
We're definitely unique.
Yeah.
I'm a born and raised Michigander, so I think we're unique
Hear, hear.
and amazing.
Hear, hear.
We have a state that is demographically and geographically diverse. We have a very large state, which I think maybe we don't necessarily always think about when you go to the bottom of the state all the way across the UP. We have a very vast state.
It's incredible.
And with that, we have the beauty of, we were talking about this earlier, but the beauty of variation, right? One community in Michigan can look very different from another community in Michigan. So when we think about maternal health, and so that's amazing that we have a broad collective of folks coming together to make Michigan one of the healthiest places to have and raise a family. But with that, there's also the challenges, as I said. So the challenges of the geographic vastness, the weather, varying resources. Resources are often driven by populations. And so that's definitely poses a challenge in rural areas when you have a smaller population, maybe a smaller tax base, those types of things that can limit the resources both in tangible dollars, but then also in human capital, which is why there's excess challenges when it comes to clinical providers, nurses, those types of things.
Yeah. So unique in one sense, but most likely other states that have the rural aspect and the poverty rates may find some commonalities among those states. So let's talk a little bit about if you were to say what you feel your role is in maternal health care as MDHHS. I mean, what do you wear on your shoulder? Like, I'm responsible for that, and we really need to reduce it. What would you say that is?
Our role is working on behalf of the families. So that means actively having a relationship with families throughout the state of Michigan, being someone personally and then an entity that's trusted, and removing barriers, supporting things that are working well. So you mentioned centering pregnancy. We know centering pregnancy is amazing.
It is.
It's proven to be effective. It provides, it's for those folks who don't know.
Yeah, could you talk a little bit about centering? Because I think there's, to be honest, I've been in the industry for 15 years, and I really didn't know about centering until about a year ago. And then after I understood the concept of it, I'm like, why aren't we doing it? And then I was told about, well, you can't do it. We're rural, we're this, we're that. We can't afford that. You have to have a separate place. You're going to have staff. We made it work. But talk a little bit about what it is. What does it give access to?
So what it gives access to, centering pregnancy, is evidence-based group prenatal care. And it's a model that I really think if we think about it, it seems common sense to me in a way.
Doesn't it? Yeah.
There was a time when folks came together and had a sense of community. And so the cohort or a group of moms who are have the due date of similar times, they see their prenatal care provider in a group setting. And so for individuals who are concerned that they don't get time with their provider specifically, they do get individualized time, right? Yeah. When examinations and other things are needed, they definitely have that one-on-one time. But what it does is that it brings together patients and they develop relationships. They have that sense of community. They are also able to have a sense of empowerment to be in charge of their care. So they do things such as weighing themselves, helping with their blood pressure checks, just a host of things that puts the patient in the driver's seat, which is truly patient-centered care and what people want. It really doesn't impede clinic flow. If centering is done correctly in the manner that's supposed to.
It should actually improve.
It should actually help. Yeah. When you're seeing 7 to 10 patients at one time. It's beneficial for the providers because they can oftentimes see the patients in a different light. When they're amongst their peers, you might be getting very truthful responses, and challenges may be shared that may not be shared otherwise. Yeah. If someone was one-on-one in a room with a provider. And related to that, it's great for teaching others, whether it's residents or mid-level providers. And then, but I really think the most important part, it's the relationship building. Yeah. Patients that are part of centering, they bond with the other patients that they're in centering with, so much so that the model also has a centering parenting component.
Yeah, there is.
And so,
which we're actually looking at that. And centering pediatrics we're looking at as well. But there's some great growth that comes out of this program.
Yeah, absolutely. So families can lean on one another. You'll find ride shares happening, babysitting happening together, really, again, having that friendship and individuals to lean on that you may not have, particularly if our world now can be very isolating. Regardless of whether you're at the center of Detroit or whether you're in the furthest point west in the Upper Peninsula, we don't have as much human interaction.
Right.
And so that time when we can interact with others is so valuable. And again, it's proven effective. Very similar to home visiting.
Talk a little bit about that.
Absolutely, sure. Well, I've been a home visitor in the past.
Is that right?
Yeah. The Nurse Family Partnership Program, the state has, speaking of Medicaid, we have a homegrown program called the Maternal Infant Health Program that was created in Michigan, is funded by Medicaid. And nurse home visitors go and see families, as well as social workers, provide ongoing support, education, remove barriers, address challenges that families are having. And what that does is it results in better health outcomes, but also better social outcomes. You see families who have lower unemployment rates. They're able to go on and pursue higher education as a result of barriers being removed from them. And it's all rooted in relationship. Yeah. Someone cares, someone's on my team, whether that's someone in centering or whether that's a home visitor.
Yeah, it's incredible. It really is. And when you think about it, Dawn, it's social determinants of health. Because one of the things that really impressed me is when we had some of the moms show up for centering, one of them did not have access to a prescription and some other things for herself, including nutritional food. And so our staff worked with her through some community resources. That's the value added of those type of programs as well. It is the getting together with, others, but it's also the reality of resources that are available that otherwise a mom may not have access to. And I think that's some of the great things that we see come out of the program. It really is. So hats off to you because you certify the program, correct? Is that the role of MDHHS?
So we work with the Centering Health Institute, which is the national program, and then have received funds through Healthy Moms, Healthy Babies to expand it across Michigan. So last year alone, over 25 new sites were stood up as a result. And now, speaking of Medicaid has an additional reimbursement for centering pregnancy or group prenatal care.
Yeah. Phenomenal. Let's kind of narrow in on rural health, okay? Because that's really the focus of our podcast, and everything you've shared impacts significantly rural health. But in your opinion, what do you think needs to happen in rural health for us to see improvements in maternal health care? Because rural is different. You're a statewide agency, so you're serving Detroit, metro areas, urban areas, and then you also have to serve me in Hillsdale, which is very big county, very rural county. So what would you say if in your mind, if you could just make it work, what needs to happen in these rural areas for us to see the improvement?
I think the value of rural healthcare and the importance of it, both throughout the entire life course of someone from birth to death, needs to be invested in and understood that when we think of safety net, rural health is a safety net for rural families and rural communities. And as I said before, it's an economic driver and a necessity. So I think that needs to be centered at all times. In addition to that, we talked about the variations in the state and the strengths that are in the state. And there's an amazing feel. I visit, serve the entire state, as you said. And when I visit rural hospitals, rural providers in general, even at their own practice, there's a definite feeling of community. It's intimate. I said this to another hospital, a smaller hospital that I was visiting. It has almost like a boutique feel.
It does.
You get unique patient-centered services that you may not get at a larger facility.
It's like concierge medicine.
Exactly.
It's incredible.
People know who you are,
Absolutely.
which can have positive or negative benefits, but for the most part, positive. And rural providers are used to working autonomously and possessing a wealth of skills. Yeah. So in a hospital that's small where there may not be a birth every single day, those who work in the birth unit need to stay at the top of their game.
That's right.
And so they're well-versed, whether they're working in labor and delivery and they're pulled to the ER or pulled to surgery. You're seeing again, those are strengths that individuals are multifaceted. And the value of that should never be underestimated or invested in.
Yeah,
it's critically important.
That's right. So I had a board member that moved from the Detroit area, and she used our healthcare for the very first time, and it's what eventually led her to become a board member. But she used it for the very first time, and I received an email, and the email was the Top Country Club. I'm thinking, who is this person? I don't golf. I'm not going to the country club, and she proceeds to tell me that Hillsdale Hospital is like the country club of medicine, because of the concierge type service, boutique style. And that's really what we're doing, impacting the lives one person at a time. That's so important. And that's what we're all striving to do. And you and your agency, obviously, it's one family at a time. And that is what's so critically important. We've more than gone over our time. I could talk to you for 2 hours. But is there any other factors, issues that you would like to bring forward to our listeners about what they can even do to help in this endeavor? If someone is listening today that may not need the services, but are like, I think I could help. What advice would you give?
I definitely think that it's important to create relationships with our neighbors. And in the case of maternal and infant health, listen to mothers. When I mentioned that 80% of the maternal deaths are preventable, listen to mothers.
Yeah.
Most of the time, there were signs and, the mother was verbalizing that something just didn't seem right. Yeah. And I think that for listeners and others in the community, don't underestimate the fact that the patient is the expert. And even with all the amazing medical advances that we have, I'm a nurse, and you first should assess the patient.
That's right.
And not the monitors, not the other fancy items that help us in clinical practice. And so I think if we start there, the solutions, the answers to improve maternal health, that's where you'll find them.
The most important, the human element of it, and that's so important. Watch the moms, watch the families, put your eyes on them. Great suggestions, great dialogue today. I'm so excited about the work that you're doing to lift up the voices of many of us in rural health. I know in today's times it can be very easy to get frustrated and discouraged, but know about the impact that you're making in Hillsdale County is significant, and know about the faces that you will drive out of town as you leave the studio today. Those are the faces that you've impacted. So thank you for the work that you've done. Thank you for sharing your story here with us and our listeners. If you're listening from other states, which we know you are, you have similar programs that may be available. They may not be as robust as Michigan, because it sounds like we're right there on top of this. But check out your state resources. I think if they were to go to their state website and type in maternal health in those respective states, you're probably going to find something about that there. Maybe if your state doesn't have a robust program, maybe it's time that you start that. And if you're listening today as our executive leaders that we hear from across the country who listen to this podcast, listen, this is your time to shine. Rise up. Be a voice for the voiceless. There are families out there that need you and need to hear from you. So, Dawn, thanks for being with us today. We really appreciate it. It's been great to have you on the program.
Absolutely. It's been an honor to be here. Thank you so much.
And we wrap up with kind of a neat little segment. For every guest that we have on our program, we ask them to contribute a recommendation on rural life and healthcare. Now, it could be a tip from something new to your experience of 11 years working as a leader. You have a lot of experience. Maybe it's some sage advice to a new leader about how to face these uncertain times. You've been through uncertain times before.
Absolutely.
We've had a lot of challenges in your life, obviously, and you've survived those and done remarkably well. And you've led a department that has done great things for our communities. So what recommendation would you, we're going to leave this on our ruralhealthtoday.com site, but what would you give as a rural health recommendation for someone listening today? A leader, aspiring leader that wants to be someone just like Dawn?
The recommendation that I would share would be, and it's something I started with, take time to reflect on history and where the community's been.
Yeah.
We don't want to stay in the past, but we can learn so much from the past to inform us as we move forward. And then, again, lean on the experts,
yes,
which are the individuals that we serve, whether you call them clients or patients or community members. You absolutely need to do that.
Faces that we see in our family, our churches, our
Correct.
Social clubs, wherever it is, these are the real faces that you're making a difference in every day. So Be a voice. Dawn Shanafelt, Director of the Division of Maternal and Infant Health at the Michigan Department of Health and Human Services. Congratulations on your great successes and the work that you do. We appreciate you being here in the studio today. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com and make sure that you've subscribed to the show so you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.